Everybody, happy hump day on this lovely Wednesday evening. I'm getting my stuff all set up here. How is everybody doing tonight? Hope everybody's having a great week as we roll into the Easter weekend. I know a lot of you, it's a big event for many of us. Easter, Good Friday, and just hope you guys all stay safe, number one, and enjoy this wonderful, important weekend, like I said, for many of us. Of course, this is Mel. Charlie is, I think he's working again. We're gonna have to, uh, we're gonna have to get him another job, I think. But I'm not sure if he's gonna jump in or not. But tonight we have an interesting show. It's Lisa Rantz with the Hawaii State Rural Health Association, and Randy Kurohara from Community First will be on to talk about the statewide health survey that is currently being run until the end of the month. And we're hoping, I know a lot of our villagers have already uh, clicked on that link on my post and took the survey. We're hoping after tonight we all take the survey so we can give the feedback to our policymakers, health officials, so they can get a true snapshot of how we, the residents, the people that live here in Hawaii, feel about our health system. I know COVID, we'll talk a little bit about what it had exposed, what COVID exposed. Some successes. Of course, we had some good things, and we had some experiences that really exposed us for what we were not ready for. And I think that's what the purpose of this survey is so they can get a true real time get true real time feedback from the users of the service, of the medical service, which is all of us. So they'll be on tonight at 7 o'clock. Um, Hoping we can get a pretty good crowd tonight because I think it's important. I really do. You guys all saw the news today. Our weekly report came out. Of course, the numbers are still rising every week. We had 8 more deaths today, but the more important information: 70% of the tests right now is BA2. It was 40% last week. It's 70% this week. So we know the direction it's going. The more concerning number is the 4.9% positivity rate in the state of Hawaii. 4.9%. That's high, folks. I mean, I know, I know the feeling is that COVID is going away um, with a positivity rate of 4.9%. We all know. I mean, we've heard the experts talk over the last 2 years that in fact it's 4.9 is not a good place to be. It is definitely not a good place to be. It was interesting that the what's that guy's name, Brooks Bear, the spokesperson for the state, was saying that even they recognize that the numbers are much higher. The case counts are much higher because of the lack or the reduction in testing, as well as the increase in home testing, which do not get reported. So it's we're in that space right now that we got to really be careful. I'm thankful that the CDC extended the order for the mask mandates for travel, for public transportation, airplanes, airports, buses. I know there's a lot of people that feel it's not necessary. I was watching the news tonight and they interviewed a passenger that was quite upset. She said it should be left up to the passenger. Well, I disagree. When you, and of course, the airline lobby was very strong. They put a lot of pressure on the CDC to lift the mandate. But think about this. Yeah, this is the way I look at it. If they remove the mask mandate from flying from airplanes, I think it would impact. There's a lot of people that would be very uncomfortable to travel, to fly 5 hours, 6 hours, 8 hours, if no one was required to wear a mask. So they say their filtration systems are safe. Dr. DeWolf Miller, epidemiologist, was on the news tonight, and he said that while the filtration systems may be okay, the person sitting next to you, who you may not know, without a mask, can be quite dangerous, regardless of what type of filtration system that the airlines believe they have. So anyway, um, so I was very happy. I was very happy with that news. But nonetheless, 70% of the cases in Hawaii this week, as reported today, was 70%, which is significant, and the positivity rate, which is even more alarming. I see Randy in the green room. Lisa, I see you in the green room, but you have no video. I'm not sure why. So she there. Oh, she was hiding the video. The old trick of hiding the camera. She was eavesdropping, but she didn't want the camera to see her. We cannot hear her yet, but we will bring them in right now. This is Lisa, and this is Randy. Aloha, everyone. Welcome, and thank you for joining us tonight.
Thank you for having us, Mel. We're excited.
Not
Yeah,
as
thanks.
excited as me. We have been doing this now for over 2 years, and we have been, 99% of the time we've been talking about COVID, and we've had experts from all over the place talking about COVID. So it's actually refreshing to have a topic um, somewhat COVID related, but not directly. And we'll talk a little bit about that in a little bit. But yeah, so it's actually really nice to have a discussion that hopefully will be interesting, and I'm hoping that it will get our villagers to jump on. I know that I have received numerous messages from people that already took the survey since we made the post, and I'm hoping tonight, after hearing from you two, that all of our villagers will take the survey. Yeah, Laurel says the survey was easy and quick, so I'm sure you folks will have a lot to say about that. So folks, we have again Lisa Rantz. She's the president of the Hawaii State Rural Health Association, and Randy Kurohara, executive director of Community First. Uh, we asked them to join us to talk about this statewide health survey assessment, whatever you want to call it, that's been, I guess, provided by or funded by the CDC. Well, I'll let you folk explain. I'm sure the villagers can determine or tell the difference between Lisa and Randy, so I don't think we need to. And your names are there, so thank you again for joining us, Lisa. Why don't we start with you, and you can give us a quick introduction of yourself and how you got involved with this project.
Sure. Aloha, everybody. My name is Lisa Rantz, and I am Executive Director for Hilo Medical Center Foundation. That's my day job. And with my volunteer hat, I am President for the Hawaii State Rural Health Association. And so, in that role, I have seen a lot of disparities and a lack of resources across the neighbor islands, experience it here on the Hilo side of the Big Island. And so we came up with the idea that it's time to stop studying our shortages and our lack of resources. We've got great relationships in Hawaii. And so it's time to pull together, gather all the data in one place, get the voice of those that are not always heard, our Native Hawaiians, our Kofa populations, everybody. So we want to hear from everybody. We want to take this to policymakers and say now is the time for action. And so that's why we're here with Mel tonight. So thank you.
Now is the time for action. That's music to my ears. I got to tell you, it's just, yes, I agree 100%. Randy Kurohara, the executive director of Community First. How you doing, my friend?
Yeah, I'm doing well. How's my audio, by the way?
It's okay. It's okay. We
It's
can
okay.
hear
All
you.
right. Yeah. So my name is Randy Kurohara. I'm the executive director with Community First. We're a nonprofit based on Hawaii Island. We've been in existence since 2014, and a lot of the work that we do is really around convening or bringing together our providers, our medical and social service providers, to work around challenges and opportunities to improve health and healthcare. So that's kind of like the mission, the focus of the work that we do. Our role in this project is really to work alongside the Hawaii State Rural Health Association, so BCNI, and we basically got funding. So this project, for the most part, is funded through a grant through the State of Hawaii Department of Health, Office of Primary Care and Rural Health. So our project was started off on Hawaii Island. So we started it off here first as a pilot. We did it during the month of November of last year and part of December. And so we have results of the Hawaii Island results that we can share with you this evening. And currently, right now, during the month of April, we're doing the rest of the state. So that's why we're here. We want to promote it. We want everyone to take part in the survey.
Awesome. You know, one of the things, COVID, did not, it went on our third year, and it exposed a lot of things, and not just in healthcare, but in many facets of government. It exposed some of the things that we were doing well. It also exposed some of the shortcomings, a lot of what occurred within the health industry, the health systems. You know, we can remember not long ago where we were running short of oxygen, and we were obviously short of hospital beds. We had to bring in uh, traveling nurses and doctors, and there were a lot of things that we just were not prepared for. And COVID, I guess, if you try to take out the positives um, of COVID, it identified some of the areas that we have to work on. And you know, you talked about the underserved community. We've been talking about this for a long time now, with some of the doctors in our state that actually work with the outlying areas, the kupuna, the those that cannot afford medical or cannot get to medical services. So this survey is going to hopefully data, real-time data, that hopefully will be used as to create the action plan moving forward. So, how, Randy, you said it started as a pilot on the Big Island. How was the response, and what are we finding out so far?
Yeah, so, part of the strategy when we launched our campaign here on Hawaii Island was to make sure that we reach as many people as possible. So part of it was done through a online, anonymous survey, which is what you folks are doing now, what's available now. And we promoted it through social media, print, radio. We did TV advertising as well, which is what we're doing right now statewide. And we also did something where we had people like boots on the ground. We had people going out to farmers markets, to vaccination clinics. We had people in front of supermarkets handing out surveys because not everyone would take the time to do it online. So we thought if we could capture people at these events when they're sitting and waiting for something, or if they're going in and out of a store, it's a great time to promote the survey. So we made sure that we did our best to also reach out to those communities that are hard to reach. Again, we showed up at events, farmers markets, vaccination clinics, places where we know that some of our populations that are usually hard to reach are there. So just to make sure that we had fair and equitable response. So yeah, I hope I answered the question.
Yeah, and has the response been good?
Yeah, it's been actually really good. So on Hawaii Island, we received over 2,000, over 2,300 surveys that were done online or in person. We also had, and that was from people in the community. But then we also had over 200 providers actually fill out the survey as well. So these are healthcare providers that took their time to go online and fill out their portion of the survey. So there is a way that, if you're a community member, you click on a certain button, it takes you to those questions. If you're a provider, there's some separate questions for the providers as well. But yeah, the response was amazing.
Well, that's good. You know, about I guess 2 or 3 weeks ago, and even earlier than that, I received an email from the Department of Health that I would be receiving a call from someone at the Department of Health to do a survey. And I gotta say, they were very persistent because they kept calling and calling and calling, and I don't answer phone calls with numbers that I don't recognize because of all the scams that are going on. But I eventually answered, and I went through a survey that took I gotta say about 20 minutes to half an hour, and it. Initially, I thought, was this the same survey? Is the Department of Health part of this Community First program that's doing this assessment. But it was clear to me when I learned more about your survey that this wasn't a part of that survey. So apparently, the Department of Health is doing an anonymous survey about access to healthcare. And I'm wondering if that's creating a problem where if I did the survey on the phone, I may not do the survey online because I think maybe it was the same thing. Well, I did take the survey online, and it is completely different. It has nothing. It is not nothing like the Department of Health. Have you heard about that survey taking place? And I did validate it. It is happening because when I got the email, I wanted to make sure it wasn't a phony email. But the Department of Health is doing a telephonic survey. But again, completely different. With your survey, I felt like it was more personal. It was more in line with the user of the services of healthcare. And the options given, one of them was even, which I thought was really cool, was regarding um, I guess the bedside manner. I forget the exact term, but whether or not the bedside manner of the health provider would stop you from seeking help because you weren't comfortable or whatever the case was. And I thought that was quite personal and very important as well. So as you're getting responses, I'm not sure if you guys are able to see the responses yet or you get it later, but are you seeing that a lot of people are you guys learning or seeing things that maybe weren't so evident prior, Lisa?
Absolutely. So already, since launching the statewide survey on April 1st, we've already have about 3,000 surveys. And the additions, and like Mel said, we really want to hear from the community. We want to hear from the providers. And what we're seeing is there's a lot of behavioral health issues. People are really struggling. They're stressed out. They're having trouble with reentry into life sort of post COVID, and all of the things that are happening, the rising costs, inflation, cultural competency, putting off care because, like Mel said, the doctor's bedside manner. But it's more than that. A lot of folks have postponed care, or resources were scarce to begin with prior to COVID, and then not being able to fly during the lockdown. And now, we have more than 100,000 more people on our MedQuest rolls than we ever have before. So 30% more of our community members, our Kama'aina, are now on MedQuest. And a lot of our providers simply can't afford to see all of the patients that require care just because of our low reimbursement rates. So we sort of have a perfect storm happening. And, even our more affluent people in the islands have had to cut back on things like food, on shopping. Yeah, so they've we're seeing it across the board. So you can imagine in more of our rural areas what kind of impact that's having, especially with the costs of transportation right now.
The neighbor islands have always been struggling for resources, and especially, like I said, the rural areas, Kauai. Obviously, our situation here, 9 ICU beds. We've always had issues. Many of our patients need to go to Oahu for treatment of certain conditions. So we've always had that issue. COVID really amplified that. Uh, and I know that the same, we've had Dr. Akiona on our show. In fact, she was just on Monday night, and she shared the problems that those, I don't know what you call them, independent doctors or those not affiliated with the large corporate hospital systems are struggling with reimbursements. And in fact, a lot of these doctors are out there in the field serving our communities and really not being compensated.
Precisely. That is one of the things, well, one of the reasons why when Randy and I were talking that this is so important, because we hear all this information anecdotally from the community members not being able to get care to the providers not being able to stay, right, having to reduce hours. 49% of respondent providers on Hawaii Island are considering reducing hours 44% of them are considering moving to the mainland because of the cost of living and the low reimbursement rates. So when we talk about reimbursement rates, and then we all understand the dynamics of the general excise tax, right? We have a high tax burden in our state, and the hospitals and our federally qualified health centers don't pay that tax. But our solo and small practice folks that have a mission, right? They have the heart to be out there taking care of our community members, and they're the ones that are paying that tax, and it exacerbates our access to care issues. So if they don't make enough money to pay their staff and to pay for to keep their doors open, we've got doctors that actually the income that they bring home qualifies them for food stamps.
Well, that was one of the concerns Dr. Akiona talked about, is how many of our professionals are leaving. Um, and while some are leaving the state, some are leaving the profession, maybe retiring early or just saying, hey, we've had enough, it's too tough. I, I guess the real question is, how do we resolve that? That's a pretty serious issue, I think. You never hear about it in the news, right? No one talks about this problem when you watch the news. I watched tonight. I didn't hear anyone. In fact, I watch the news every night and every morning. And we finally heard, I think we heard from the nurses union leader yesterday or the day before, and he said that uh, we're still in a tough spot. Our nurses are struggling. The hospitals are full, and we're still having a rough time. Even though the numbers of COVID cases may be going down, people are trying to catch up on the care that they had put off because of COVID, and that doesn't seem like it's going to be going away anytime soon. Lisa, you're on Oahu, right?
I'm on the Big Island.
Oh, you're on the Big Island too.
Yeah,
Okay, and Randy, so you are well aware of the issues of rural Hawaii and the struggles that we have.
yes.
What, Randy, what do you see? What do you see in your? I know you call it Hawaii Island. I know people get offended when you call it the Big Island. I don't know. That's just how I was raised. But on Hawaii Island, what are the bigger issues? I guess more for the underserved, the people living in the rural communities, far away from medical services. What's the biggest challenge for Hawaii Island?
I think what we saw during COVID was, and it really became clear that there's a part of our population, they're, geographically isolated is one area, and the other one is also with regard to sort of health literacy or culturally, healthcare delivered in a culturally appropriate way. So there's these gaps that exist, and I think part of what we want to see as sort of our next steps of this project is one, I mean, the survey and the campaign that we're doing right now throughout the state of Hawaii is really to better understand what the state or what Hawaii needs to, to ensure that people have access to, timely, quality health care close to home. One of the goals that we have on Hawaii Island is to really bring our collective, which is sort of the work that we do as a nonprofit, is we bring the providers together, right, and let them work together as a community, put the community first, right, and look at ways that collectively we can lobby for perhaps more specialists on our island, right? We find that a lot of our people in the community have to fly off island, fly to Oahu, right? So while there's a major part of our population in Hawaii that lives on the neighbor islands, pretty much all the hub of healthcare is all in Honolulu, right? So we want to see what can we afford if we work together, right, as neighbor island communities, right, or rural communities throughout the state of Hawaii, if we can collectively, provide more care closer to home.
That is the ideal, right? You want to be able to. Yeah, I think about all the kupuna. What do you call it? The federally funded health centers, like on Kauai, we have
FQHC.
all of. Yeah, yeah, yeah. Obviously, I'm not an expert in this medical stuff, but we've had uh, Dr. Chong Hansen on from Ho'olalahui, and I actually stopped by a couple of his vaccination clinics, and the work they provide for that communities out here on Kauai anyway is so valuable, and they play such a vital role in healthcare for our, especially those areas outside and those that cannot get in. We don't have a very good transportation system here. So if you live out in Kekaha or Pakala, there really is no transportation into a medical facility. So a lot of these people will basically rough it. And then you also have the fact that you talked about food, and we hear the horror stories all the time about our kupuna who they need to make a decision whether they're going to pay their electric bill or buy their medication or buy food or medication. And I guess for me it's and the survey will basically reaffirm what we should already know, right? I mean, I think we've been having these issues for a long time. So the survey results will come out, and again, folks, and we'll post up the link after. I cannot, if I post it on this streaming software for whatever reason, it won't post to Facebook. So I'll have to do it after the show. So just go to my page. It's already on my page, but we'll post it up again. I saw a few people post it in the comments. If you guys post it in the comments, it shows up. I just cannot do it from my system. Um, so we all jump in on this survey, and that's why we're pressing our villagers to get on and do the survey. The more information, the better information, will produce a better result. So we get these results, and whoever can answer this, what happens next? You obviously, Randy, you guys will compile the data and you'll have a report. What happens from there? Who will put these action items in motion?
Thank
And
you
anyone
for
of you can answer.
Yeah, no, thank you for asking. So once we have the survey results, and then we're also conducting focus groups. So if you've got providers out there, please, get online and participate in one of the focus groups that we're conducting. But the next step, the next phase of this, because obviously it's the strength in numbers, to be able to collect the data all into one place so that we can form work groups to actually put these policies into effect. And the one thing that we have, well, one of the strongest things that we have going for us in Hawaii is our relationships. So we can form those systems of care across the neighbor islands. And in the focus groups, we're hearing from providers that want to help to do that. And the flip side of that is we've been working with the insurance companies and HMSA in particular to get the procedure codes by what is being flown off island. So then we'll know exactly what procedures and in what quantities are being flown off island to Oahu. So then we can look to see if they can put some recruitment dollars to help us to get those services on island, or we can work with the specialists on Oahu so that we can have them fly out to the neighbor islands to provide that care. So that's the next step of this, is to really look at forming those systems of care and getting the resources that our community deserves.
Awesome. Are we getting the cooperation from the providers, from the Queens and the Straubs and the Kapiolanis and all of these huge hospital systems, Kaiser? Are we getting cooperation? I mean, is that something that you believe this survey will help bring everyone together? I know that's the intent. Is that something that you both see will be happening, and that in fact some positive change will happen from here?
I think so. I think we're getting a lot of momentum, and I'll let Randy talk to this as well.
Yeah, so we've reached out and we have the support of several of our hospital systems throughout the state of Hawaii. And I know for sure we have HCA, Kaiser, right, the Hawaii Health System, which is a state system as well. Um, and yeah, we're reaching out to all of them, so they're sharing the surveys with their members and with the providers to make sure that we have a good, you know, make sure that our results are good.
At 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 some point, I mean, policies can be made at the hospital level, at the medical. Uh, it doesn't sound right when you say medical industry, but in that arena, policy changes can be made. Is this project looking at possible legislative action as well from the state, from our legislature? Uh, is are changes need to be made in our laws to make sure that our people have equal. I mean, wouldn't it be great for everyone to have equal access to health care? You know, uh, if you get arrested and you can't afford an attorney, you get an attorney, right? The state provides you an attorney at no cost. Uh, that doesn't necessarily, that's not necessarily true with healthcare. There's so many requirements, regulations. There is a level of healthcare that may be available for you, but not in all cases. So is that something we that we need to work on as well? You know, I'm not sure. Is that something that we would have to be looking at as well?
I think that healthcare should be our number one priority. And I don't say that, I say that as a community member. I say that as a mom of twin boys that graduated UH and came back and started a vet practice on Hawaii Island. Um, a lot of parents can't say that their kids are coming back from college on the mainland because they can't afford it or they don't want to have kids here. We've had doctors that left in the past year because they can't get healthcare services for their families. And so, if a doctor can't call in favors and get healthcare, how do you expect our average everyday citizens to get healthcare services? And the most recent Department of Labor study shows healthcare as the number one industry to make a living wage job, whatever that means, right? But healthcare is number one. A distant second is your information technology or IT jobs. And then third are your skilled trades, plumbers, carpentry, that type of skilled trades. So it makes sense from our vantage point if we develop workforce pipeline programs to help our community members, our students be interested in the various types of health careers. They're not all clinical. There's all sorts of other support services. Then that's going to help our community all the way around. So I think that that's one outcome that we're looking at right now, and then some policy changes to build out that infrastructure. And then I saw in the chat, yeah, specialists used to fly out to the neighbor islands, but they change over and you don't have continuity of care, and it might not be the same provider each time. So you don't have that patient physician relationship. And I think we can do better on all of those things. And from hearing from the providers, they're willing to work on this. And when we are talking to our state legislators, they're listening, they're willing to look at it. So if there is a silver lining of COVID, like I said, now is the time to take action.
And that's kind of what I was alluding to when I talked about COVID, exposing some of the shortcomings. This is an opportunity to reset, rethink, reassess. I mean, we have the excuse, we have the political cover to, redesign healthcare because of what we found out because of COVID. So, as horrific as COVID has been, let's use it to make some positive change. I'll give an example. But my two kids fit into the category you just described. They live in Oregon. They just, there's no way they can survive here and have a quality of life. This generation, they're a little different. They're just different. And one of the things they had to do when they went to Oregon was to go get medical. They had to get medical coverage. They had, number one, they had many options. I assisted. I went online and looked at options for an Oregon resident that was looking for individual insurance. Individual, they don't have families, and the options were great. They had many options, and the price points were affordable. It's not like that here in Hawaii. It's night and day. And then the other example I'll give is, and I saw someone post, when you go to the hospital, first thing they want your insurance card. That's you pretty much, that's your pass to get in, is an insurance card. When many years ago, my mom had cancer, and we took her to the Mayo Clinic because we just wanted to get her the best care. And we took her to Rochester, uh, Minnesota, and that was the last thing on their mind was insurance. They didn't care of coverage, and they treated her as if she had the best medical in the world. And yeah, she was a kupuna. She was older. She didn't have the best medical coverage, but it didn't stop her from getting the treatment that she needed. And by the time it was all said and done, her bill was insane. and they weren't concerned about repayment. They weren't concerned, and I understand it's different because that's the Mayo Clinic. But my point is, how do we get access? How can someone that doesn't have access to high quality health insurance, how do we assure them that they get the same treatment as the person that has the best medical coverage? And that is a challenge because of the cost, right? That's a challenge, and I'm not so sure how we fix that. Uh, I don't, and maybe you folks have some ideas. I don't know.
It's going to take the village, Mel. This
Yeah,
is
I know, I know, I know.
why we're on your show. We were
Well, we
reaching
have
out
a bunch of villagers have already posted that they want to help. They want to help, and again, guys, the best we can help right now at this moment is by doing the survey, and we'll post up the link. I know a few people have already been posting up the link, so go ahead and copy that, and don't do the survey during the show, but we'll do it right afterwards.
Yeah.
But that's going to be the initial part, and then as especially for our providers out there, and on this show, it's a unique phenomenon on the Mel and Charlie show. Uh, we'll end the night with maybe 100 live viewers, and then when you look first thing tomorrow morning, there's 600, and then you look in a day or two, there's 2,000. No one wants to watch it live because their names show up on the screen, and they're afraid they might get called out.
Yeah.
So if you're watching this live, if you're watching this tomorrow, the next day, guys, we just got to do the survey. And for the providers, get in touch with these fine people and offer your services. These focus groups sounds like it's going to be very powerful, and it can provide a lot of help for this project. Now, I know you mentioned about actually handing out physical surveys at vaccination clinics and so forth. Uh, for Kauai and for the neighbor islands, if someone does not have a computer or would just like to get a paper survey, a hard copy, how can they do that? Can they do that through the local hospitals or the clinics here?
So we have Project Vision that we're working with on Kauai. And so they'll be doing a couple of events during the month of April. And then you can also reach out to the Kauai Rural Health Association. So they will have paper copies and packages. And then we're working on getting them out to the various clinics to help with that. So if anybody's willing, we're willing to send them over to help with that outreach. So if you've got a passion for rural health and you want to help us with some boots on the ground efforts, we will take you up on it 100%. And then on the survey itself too, you can put in that you would like the results of the survey or to participate in a community focus group. So we do the community focus groups following the survey to get the extra stories. And I'm seeing a lot of posts scrolling up here, just heartbreaking about not having great insurance, but not having access to care and not being able to get care when you need it. And that's why this is so important, because Hawaii's done an excellent job of getting everybody health insurance, but having insurance doesn't mean that you've got access to actually receiving that care. And that's what we want to fix.
Yeah, and again, you all know the challenges of living on a neighbor island. I mean, you're there, you're experiencing it as we are here on Kauai. Um, so I think, Lisa, if you could email me later the list of maybe for all the islands, if you can list just send me a list of where people can access the hard copy, and then I'll go ahead and make sure we get that out. And if anyone's interested, guys, you guys, most of you know my email. You just message me if you have any questions. But if you have any questions for these two, for our guests, just go ahead and punch it into the. Here's one. I'll put it up on the screen. We'll just get some of the questions, and you guys can take a shot at them. How does the surveys help in general? I think you kind of explained, but I guess the ultimate goal of these surveys is to create change, whether it's policy change or changes to access. But how would you say what's the overall goal of the survey?
I can maybe take a stab at that. I mean, one of the things that we try to do is collect qualitative data and quantitative data. So the surveys help us with the quantitative data. So if a certain percentage of the population feels this is important, right? So you have quantitative data, and the focus groups again, all themed around questions and feedback where you can capture people's responses to different questions. So we kind of, saw this as like a not just a focus group effort, which a lot of needs assessments are done through focus groups, but we wanted to make this like a community where your voices can be heard. But I would like to ask this. I mean, of the viewers that are on, right, and just this and looking at the messages, a lot of women. We want men to fill out this survey, okay? Because what we found is that throughout what we've experienced on Hawaii Island, right, is just to really make sure that it is representative of, the people of Hawaii, right? So um, we need more men to fill out the survey. So if you could encourage your spouses, your kids, your adult kids, whatever, to fill out the survey. And if as much as possible, we need more guys to fill out the survey.
You guys heard the challenge, guys. Let's go get them. My gosh, it's not hard. It's actually quite painful. I mean, painless, painless, painless. Um, how in general, how does Hawaii? And again, we're kind of focusing on those that don't have access. Is that the same in all states? Does all states have that problem where? I mean, we cannot be the worst, but is that a common problem throughout the country where you have these segments of the community that have challenges with accessing healthcare for whatever reason?
I think COVID really exposed the health literacy and the disparities and inequities that take place across all sorts of different racial and ethnic groups across the nation. But the difference on the mainland is that you can actually drive to another location, or you can cross state lines. Um, I think was Hawaii County, according to the nurses study, was number 3 in the nation for the worst provider shortages. Number 1 and number 2 were just outside of big metropolitan areas. So one was like 5 minutes outside of like Atlanta or something like that. And the other one was 15 minutes outside of another large city. That's not the case here. And then Maui was fifth, and I believe Kauai was seventh. So 3 of our neighborhood or our neighbor island counties are all on that shortage list. And that doesn't tell you something, right? I mean, we need to stand up and we need to pay attention to this, because we can't just drive, we have to fly. And so we're not only rural, but we're remote, and we deserve better. We actually are the only state that taxes health insurance too. And so cost of care is rising up in this survey too, both on the community side with people not getting care or putting off preventative care like mammograms and colonoscopies and just other screenings, and then also on the provider side. So the voice is what's going to help elevate this for like Mel said, this keeps turning up, we keep hearing about this, and so we want to present something that can be moved forward.
Like I said, you don't hear. You hear when you look at the top issues of our state, right? You hear that we're in the election year now, so you hear a lot of it, right? It's the affordable housing, homelessness, cost of living. I really don't hear much about healthcare. Yet we all know it exists, right? We know about the shortage of providers. We know about the shortage of nurses. We had Daniel Ross on our show, and he gave us a very eye-opening account of how our nurses are suffering, working double shifts and basically overwhelmed. And it didn't end when COVID numbers dropped. It's a constant thing. COVID obviously made it a lot worse, but I guess, like you said, healthcare should be right. It should be it should be number one priority. And when we hear of politicians talk about refunding each person $100, or we have all this extra money that is available because we didn't anticipate the huge inflow of tax money. We didn't think we were get out of the COVID economic slump so quickly. I mean, well, we knew once we opened up, tourism was going to blow up and we'd get revenue. But there was no mention of putting $1 billion to improve healthcare. It wasn't, we were going to beef up the neighbor island uh, access to healthcare for those that are underinsured or in underserved communities. That's rarely talked about
Right.
as it relates to the other issues that we see every single day. And I'm hoping that if we can get enough data from a survey like this, that it will put a visual picture. Because a lot of politicians, you got to actually show them a picture.
Hmm.
You can show them a spreadsheet; they're not going to look at them. I promise you. I know a lot of them. But if you show them the picture, and maybe then people will understand. Wow, maybe we gotta start paying more attention to this.
Yeah. Well, I mean, without your health, how can you go out and play ball with your kid? Right? How do you feel about going to work when you can't even get out of bed in the morning because you've got chronic pain or you're experiencing too much stress or anxiety, right? In the chat box, I'm looking at it right now. They're talking about not being able to get behavioral health services um, through their providers. And that's what's coming out in the survey. And so I think it is going to paint a picture, and it's going to show that, you can maybe address some of these other issues by first addressing healthcare. If you want people to afford housing, they need a living wage job. Department of Labor said it's the number one job. So it
So,
keeps pointing that should be important.
Well, we want to promote a healthy community, right? You become a healthy community by making sure we have equal access to healthcare.
Absolutely.
Preventative, you would think, right? Preventative healthcare would be the most cost-effective method to reach a great healthcare system, right? One of the things that I kind of wanted to pick your brains about, and again, for our viewers, the villagers know this is unscripted. No one got questions. We're flying by the seat of our pants. So I appreciate you guys taking, and I appreciate you folks reading the comments as well. But one of the things that, and I'm not sure if it's popping up in the survey results, but is access to mental health care. Uh, I personally am seeing a lot of people affected, and it's COVID exposed the issues. It made it more visible for maybe for those that didn't recognize it before. But we've had mental health uh, problems, issues, access way before COVID landed in Hawaii. But COVID really amplified it and made people realize, holy moly! And then of course it's so easy to say, oh, blame COVID. Well, COVID exposed it, but it was already here. Is the survey in any way showing that maybe that's an area that we really got to focus on? Um, the mental health of our residents of the state.
Absolutely. So we were sure to add questions that would address that. And from the preliminary results that we're looking at, I mean, there's people in crisis right now. I mean, they're actively saying that themselves or a family member are in crisis at this very moment.
Randy, you notice? I mean, again, is this something that's well? Right now, the survey was piloted on Hawaii Island. Now it's statewide, right? Are we seeing good number of responses coming from Oahu and from the other islands? I was talking to my friend the other day from Molokai, and wow, they're struggling on Molokai. Molokai, he was talking about a situation where a child, I don't know what to call him, young adult, uh, needed to get to Honolulu. They only have that one airplane that flies between Molokai and Honolulu. But you know that when you're under 18, and again, this is off topic, but it's kind of related. If you're under 18, you can show up, make your reservation, you can get show your birth certificate or whatever, and that's sufficient for ID, and then you get on the plane. Well, once you hit 18, they require a state ID or a state driver's license. So yesterday I could fly with a birth certificate. Today I made 18. I cannot. A lot of all of the people in Molokai rely on Honolulu or Maui Island for healthcare,
Mhm.
and it's those little things that may seem little, but that is the roadblock to accessing healthcare, a flight, because you cannot, like you said, you cannot drive. Are we seeing a good response rate
Yeah.
from Oahu, Maui, and of course Kauai? And are we?
Yeah. So, I think we mentioned, earlier, there's maybe like over 2,000 responses so far, and we're in our second week of the statewide campaign. So yes, there is some pretty good response, and we're picking up steam. So we know that through a lot of our networks that we're engaging, large organizations that have a lot of members, that will be getting a lot more surveys. I think as I mentioned earlier, we need more men to fill out the survey. So again, somehow if you can help get that word out now, that would be super good. Um, but if you want to take a look at the results of the Hawaii Island survey, because we do have a 25-page report as well as a two-page sort of a graphic, like an infographic, um, for somebody that doesn't want to read a lot. It's on the communityfirsthawaii.org website. On the homepage of the communityfirsthawaii.org site, you'll scroll down and there's a whole big section on access to care. And in there, you can scroll down and see the two reports. So your viewers can go check it out. You see how thorough the reports are and a lot of the findings that are in there. We do know that one of the things that was brought out or was highlighted is oftentimes, especially for those that are working that can't afford to take off during the day to go to the doctor, right? If providers could provide more hours, maybe later in the evening, or make their hours more accessible for those that may not come during the day. So I think that was one of the things that we saw that could be easily like a low-hanging fruit, right? If a provider organization such as clinics could look at their hours for their, that they're open and see if there's ways that they can make their services more available. Um, and then also like culturally sensitive, staff as well, right? So again, a lot of people in our community may not understand very basic healthcare, topics, So those are things that I think became real evident during COVID, as we tried to reach out to our populations to get vaccinated, right? We found that a lot of people don't either trust, is a trust issue or just a literacy issue. They don't understand. I think these are like, again, areas where I know there's funding right now, and I know that these are things that we can kind of work on right away.
Okay, let me just do this real quick. This is the website, folks. Communityfirsthawaii.org. Hawaii, communityfirsthawaii.org. And I'm just going to scroll down real quick. Oops,
Yeah.
what did I just do? There we go.
Yeah.
I'm just going to scroll down real quick, and there's it's great. There's all this information here, featured programs. This is the one, and of course, there's Lisa. You can watch her in another video, YouTube. But this is where you need to get to. Take the survey, and they'll be giving away $100 gas gift, $100. By the way, I filled up my truck today, $92. Son of a gun. I hope I'm the gas gift card. But anyway, every week they'll do a randomized drawing, and they'll get away. So you take the survey here, folks. Communityfirsthawaii.org. Take the survey. But what Randy was talking about is here. Here's the Access to Care Hawaii Island Report, or the Island Report Summary, and you can do this later. 21% of respondents could see a provider when wanted. Listen, that's just the first page. I'm not going to go through this whole thing. 2 out of 10 people was able to see their provider when they wanted to. Well, I don't know about how it is on Oahu, but I can tell you on Kauai, if I called my doctor, unless I was dying, um, I'm living with a kidney stone in my kidney right now, 2.5 centimeters. That obviously have to do the surgery in Honolulu, on Oahu. But my last surgery was supposed to be last month. I unfortunately got sick the night the night before the surgery, so I missed that one. They couldn't get me back in until May 11th, 6 weeks. So that's kind of scary when you think about it. Anyway, guys, feel free to go check it out. Go check it out when you get a chance. But the most important thing is take the survey, and it's very simple. It's anonymous, and we really want you guys, the men, to do it. All right. We want as many guys, and you too, ladies. But you guys doing a good job already, so we, we want you guys to go take the survey. It's very quick and easy, and it's private, so you have an opportunity to share your experiences, guys. Again, like they said, it takes a village to make change, and this is a great start. So
And I know we've been focusing sort of on the negative aspects and the dire situation of shortages. But, I do need to say we've got passionate providers out there. We've got wonderful community members. There's a lot of people that are providing great care across Hawaii, and they're working very hard doing it. And so we're also looking at what's working well and what scaffoldings and supports that need to be put in place so that they can continue doing that great work. So it's about those positive and those bright spots as well, and how we can spread those out and form some centers of excellence for care across Hawaii. So, I know that we're kind of pounding on the negative pieces, but there's a lot of great things happening and a lot of passionate and caring people providing care. And like Mel said, they're burnt out, right? So make sure you thank your healthcare workers. Give them some malama. Take care of them. They really deserve it.
and this survey gives you the opportunity to see what's working. I will. This is a great time to shout out to my doctor, Dr. Lillian Kang here at Kuhio Medical. They're not part of the bigger hospital systems, but I got to tell you, I have absolutely no complaints. And one of the things I noticed, we talked about this Monday night with Dr. Akiona, was when you go to these smaller clinics, for referrals and things like that, it's actually no, there's no issue. Dr. Kang, if it's beyond what she can handle here, she doesn't have a problem referring me, whether it's to Queens or Straub or any place else. There's no. It doesn't seem like she has as many barriers to send me where I need to go to get the help I need. And I'm not sure if that's just Kuhio Medical. I'm not sure if that's pretty consistent. Lisa, you would probably know. You work in the actual healthcare. You work at a healthcare facility, right?
I do. Um, and I think that it runs the gamut. I, I think some doctors have better inroads and connections to be able to get their patients seen. And I think others struggle to get referrals. And some of it is just the wait times because more and more people are accessing services. And so you kind of get in the queue. Um, and it's kind of hit and miss. And like you said, they could give you your follow up for 6 weeks, and that's what we're seeing in the survey is people are waiting 4 and 6 months to get care um, for biopsies, for cancer, potential cancer. That's frightening. So I wanted to talk about positive stuff, but here we are, kind of back, in the rabbit hole a little bit. But we just need to build the infrastructure around it and build upon the good work that's being done and get additional resources, whether that's providers or, our advanced practice nurses, PAs. What do we need to support the providers to provide care for our communities? How do we connect the healthcare systems to form, you know, bigger collaborations? I think they found that it wasn't as painful as they thought it might be during COVID, and Randy can talk about that. Community First was pulling together some wonderful groups about COVID vaccinations, and they were having wonderful collaborative conversations.
Yeah. Yeah, and to piggyback on what Lisa was saying earlier about the delays in care, what the survey did point out, at least on Hawaii Island, was that, healthcare was more, the way put was more delayed than denied. So in other words, most of the people could get care. It's just a matter of how timely was it, right? So there's a certain percentage that waited, more than, months. Some waited, days or weeks. But what we found was that it was really more an issue of timely care that was, one of the barriers that we saw, with the surveys.
Yeah, so I mean, maybe we should count our blessings. If you look at Janelle's comment, big clinics have big issues with giving referrals. Wait time to Zoom with an RA doctor has been 10 weeks and counting. So I guess we should count our blessings and strive to do better. But again, it could always be worse. You mentioned uh, one of the things I'm noticing now is we have a lot more nurse practitioners. I never knew what a nurse practitioner was growing up. I mean, only recently it seems. I've been pretty healthy all my life, so I really haven't been to the doctor. But as I get older, I'm spending a lot more time with doctors. But nurse practitioners are becoming quite common now. And is that the same on Hawaii Island and on Oahu? Is that are we seeing more nurse practitioners than doctors?
I think that's part of, what we want to look at with the workforce and see, what the numbers are, because there is an annual assessment of physicians, but there is not one for physician assistants or advanced practice nurses. So Laura Reichart with the Hawaii State Nursing Association would have those numbers and be able to talk to that a little better than myself. So I don't want to back myself into a corner. I kind of like to be Switzerland and you know maintain good relationships with everybody. And I think, but that is definitely a trend. And then we do hear from legislators that if we do have providers that don't want to be here, they can't afford to be here, that we'll just use nurses and PAs to provide primary care to our communities. But the reality is we have shortages across the board. There's not enough advanced practice nurses to be able to provide care to the community members. And even the training programs, right? We don't have enough training programs. So one of the things that came out of the Hawaii Island report, well, from the focus groups actually, was that we need, a residency program to train up more advanced practice nurses to be able to provide some of these supports around behavioral health and primary care. So that is one of the things that came out. And then there is a new physician assistant school on Hawaii Island on the Kona side that the University of Washington set up their MedX program, and that has a lot of local students in it from Hawaii that want to provide care back in their communities. So there's a lot of great things happening. We just need to figure out what that looks like. And, we can say that we're short 743 physicians in the state of Hawaii, but if 700 of them arrived on a plane tomorrow, where would we hire them? Where would they work? We don't have the infrastructure to support it. And so I think we need to start with taking a look at what resources we have and how we can better utilize those resources.
I'm just going to post this one up because it's an issue that we're aware of, and one of the villagers, Desi, uh, struggles with this. Another huge problem is the shortage of interpreters to help the deaf and hard of hearing gain appropriate communication access to their physicians. So I'm not sure if that pops up in the survey. I'm not sure if that's, but anyway, just wanted to post it up. Maybe, you know, write it down somewhere, and when this gets to the focus group, because I know it's not the first time I've heard this issue, and it's true with many government services where disabled people cannot get access, whether it's because they cannot hear, they cannot see, they cannot drive. There's just a lot of barriers for the disabled community that needs to be addressed. So I just wanted to post it up real quick.
Thank you for that. Yeah.
Because we are running out of time. I did want to give you two an opportunity to share whatever is on your mind. Your last opportunity to sell this survey to the people, because we really want. Remember, guys, communityfirsthawaii.org. Please go there tonight and do the survey. but I did want to give you folks an opportunity to just whatever's on your mind. And Randy, we can start with you.
Yeah, so Mel, first off, thank you very much for the opportunity to be able to present to your audience. Really appreciate all the comments and all the questions that are coming in the live feed. Um, but yeah, we're thankful, but we're also very excited about the opportunities that will come from a successful sampling or surveying of our community. So, again, we really wanted to make sure that we allow people in the rural communities, and especially to have their voices heard. And this survey is really that chance or that opportunity. Again, to all of you out there, please, visit our website if you want to go there. There's www. Also, there's www.accesstocarehawaii.org. Accesstocarehawaii.org goes directly to the survey. If you want to look at other information about the campaign, then you can go to communityfirsthawaii.org. That's where you can find out more information and also look at the results that so far from the island of Hawaii. But thank you.
That was access to care.
Accesstocarehawaii.org.
Okay, let me put that in
Yeah,
on my
let's go
phone.
straight to the survey.
All right, I punched it out on my phone, so it should pop up. There it is. Awesome. Well, thank you very much, Randy. Thank you so much. Appreciate. Lisa.
Well, I just want to say thank you and aloha to everybody for watching this and for all of the comments. We're really taking it to heart. There's so many, it's hard for me to read through them, but I want to go back and look. And we will definitely add those to our qualitative comments. And I just encourage everybody, share this survey out with your friends, your family, colleagues. If you work with any of the populations, I mean, take it down, to the guys fishing, out on the soccer field, baseball, right? Things are opened up right now. The more surveys we have, the stronger our voice and the more we can accomplish. Remember, it's time to take action. And just thank you from the bottom of my heart.
Time to take action. We have an opportunity, us here in the village, and again, I'll repost. We are live right now on Facebook, YouTube, LinkedIn, and Twitter. We will repost the YouTube video up on my page, and then I guess the village, just share it, man. Just hit the share button. It doesn't cost you a penny. Also post the links up for the survey. We'll use the access to carehawaii.org. We'll put that up as well. And then just share the heck out of it, because it doesn't, you don't have to pay for a stamp. And if you need paper surveys, let me know. Shoot me a message. I'll make sure Lisa knows that she can get you the surveys, or at least tell you where to go get them. I just want to say thank you to Randy and Lisa for spending the time tonight with us. It was nice. It was nice to just focus on things outside of positivity rates and case counts and hospitalizations and deaths. I mean, that's all still important, but this is an opportunity for us as users of the system to share our input, so we can hopefully get some positive change. So again, thank you to the village for jumping on tonight. We will not be having a show on Friday. I decided that Good Friday is the night you guys should be home and not watching me on YouTube or anywhere else. So we will be back next week, Monday at 7 o'clock. And then I think I'm really thinking about going back to Feel Good Fridays. We'll showcase local entertainers and just have some fun on Fridays to end our week on a positive note. So look for that coming up starting next week, Friday. All right. With that, again, Lisa, thank you. Randy, thank you. You guys stay safe. Keep up the good work. Villagers, go do that survey. Have a great week. A wonderful Easter weekend, and you guys all stay safe. All right. Love you guys. Bless you. Take care. See you guys next week.